Your healthcare change is now impacting many of you.
Memorial, Hermann, and Blue Cross Blue Shield medical insurance have officially split. We're helping you navigate these changes with team coverage this evening. Cheryl Mercedes, she spoke to state insurance regulators.
But first, Katira Winfrey joins us live in the medical center after speaking to a family directly impacted. Katira?
Hey, Lynn and Mia, billboards around the city that read, "Don't let Blue Cross Blue Shield cross you out of your care," have gone up all over the place. But with the latest news, that's exactly what happened for thousands of people who need medical care. A mother's fight is never over, but this is one Blue Cross Blue Shield insurance holder Sherry Logan is ready for.
When it comes to your kids, it's Mama Bear comes out, and we're going to fight till we can't.
Her son Ryan has been in ICU at Memorial Hermann for months, dealing with neurological challenges since suffering a stroke 10 years ago.
He's back learning to walk and talk and eat and perform all activities of daily living once again.
This family is now receiving services at Memorial Hermann out of network under Blue Cross Blue Shield of Texas after the hospital system failed to reach a contract agreement.
I was like, oh my gosh, what does that mean?
Bonnie Sharon is a board-certified patient advocate and says, as one of the 2 trauma hospitals in town, this is a huge blow.
This is where Lifeline goes. That's where people go. That's where I want to go if I'm in a really bad accident of some sort. It's also got our burn center.
She says all this likely boils down to the bottom line. Premium spikes for those using the Affordable Care Act and the government cracking down on Medicaid spending, she says, is likely impacting the hospital's finances. And they may be trying to offset those losses through these negotiations.
You would hope that they would come to some resolution, but it's a big tug of war.
Families or patients with ongoing needs like Ryan are encouraged to contact Blue Cross Blue Shield immediately and look into continuity of care options. She says their bill may be high initially, but enough self-advocating and jumping through hoops, folks may feel relief.
I mean, if he can fight every day just to stay alive, then I can do this.
Blue Cross Blue Shield failed to reach an agreement back in 2022, but it didn't take them long to reach a deal. So now patients are hopeful they'll see a resolution. Reporting live in the medical center, Katira Winfrey, KHOU 11 News.
For the sake of her son, we certainly hope this gets worked out. Katira, thank you.
Many patients are now asking the same questions. What happens if I'm mid-treatment or face an unexpected emergency? It is a precarious position to be in. Cheryl Mercedes took some of these concerns straight to the Texas Department of Insurance. That's the state's main insurance regulator. Cheryl, you've been searching for solutions. What did you learn from them?
Well, Mia, the TDI oversees a portion of the healthcare market, and I spoke to them about what patients should do right now and how the state ensures insurance companies follow the rules.
What do patients need to know right now to make sure that their treatments continue while we wait on a potential deal if that happens?
If you have an upcoming appointment, call your doctor and ask them to submit that request to Blue Cross Blue Shield to keep your treatment going. That's probably the most important thing. Just be in touch with your doctor.
If a carrier falls short, what kind of enforcement tools does the TDI have?
I mean, there's everything from fines, restitution, cease and desist. There's quite a few tools in their tool belt they can use.
How would emergency room care be impacted?
Yeah, that is an exception. If you are having an emergency, go to your closest ER. It doesn't matter which one it is. There's a state law that protects consumers from being balance billed in an emergency. So that means you shouldn't get a bill in an emergency.
How does the TDI make sure that the insurance carriers actually follow through with this?
We don't hear about it until we hear from the consumer. So if someone's having an issue, definitely contact us.
That's why it's important that you let them know. High Note says the best way to file a complaint is through the TDI's online portal at tdi.texas.gov. You can also call their consumer complaint line at 1-800-252-3439. Mia?
Helpful context as people decide what to do next. Cheryl, appreciate the info.